There's one activity that cuts your risk of dementia by 76%. Not running, not swimming, not lifting weights. And the wild part? Almost nobody knows about it. And the few who've heard the number usually laugh it off. That's a mistake. By the end of this series, you're going to understand more about what's happening inside your brain, your spine, and your joints than most doctors will ever take the time to explain to you in an appointment. Before we get into it, we're pushing toward 200,000 subscribers on this channel. If you haven't hit subscribe yet, do it now, because what you're about to hear isn't something the healthcare industry is eager for you to know. A system that profits when you're sick doesn't have much incentive to tell you the cheapest fix might be free. So what's the activity? Dancing. I know how that sounds. Stay with me, because I'm not selling you a feel-good idea. I'm a physician who spent 15 years watching patients cycle through medication after medication for problems that trace back to the same root cause. Their bodies have stopped doing anything new. Same commute, same chair, same handful of movements, repeated for decades. Meanwhile, their brain runs on autopilot, replaying motor patterns it learned back in their 20s. No novelty, no challenge, no new signals reaching the nervous system. There's a clinical name for this: motor monotony. It means your brain has stopped receiving fresh input, and the neural pathways that depend on stimulation to stay strong begin to weaken from disuse. Here's the piece most people are never told. Your brain isn't a fixed capacity storage unit. It's living tissue. It either grows or it shrinks. Feed it novelty and complexity, and it builds new connections. Feed it the same loop for years, and those connections thin out and eventually fail. Now let's look at the data. Research highlighted by a Harvard Medical School physician compared different activities against dementia risk. Reading lowered risk by roughly a third. Crossword puzzles helped too. Walking, swimming, and cycling. The activities everyone assumes are protective. Barely move the needle on cognitive outcomes. Almost no measurable effect. Dancing, on the other hand, dropped dementia risk by 76%, more than double what puzzles achieved. This isn't a fringe finding. It's the kind of result that should be part of every conversation a doctor has with a patient over 50. And in 2026, researchers in Japan added something even more important. They found dancing was especially powerful for people already noticing small memory slips, misplaced words, forgotten names, tasks slipping through the cracks, even when formal testing still came back normal. That in-between zone has a name: subjective cognitive decline. It's the window where intervention actually works, before real damage sets in. I had a patient. I'll call her Carol. 63, retired teacher, sharp as ever, but she'd started forgetting names she'd known for years. Her testing came back clean. I told her exactly what I'm telling you. 6 months later, she was back in my office, and the fog, in her words, had lifted. Her only change: 2 nights a week of beginner salsa classes. So why does something this simple work at a level medication often can't touch? To answer that, we need to go inside the brain and look at exactly which structures light up when you learn a new dance move. And it's not just 1 or 2, it's 6 dot. When you learn a new dance movement, 2 brain structures do the heavy lifting first. The first is the basal ganglia, deep clusters of neurons at the base of the brain responsible for learning and storing sequences of movement. These are what eventually let you perform a motion without consciously thinking through every step. They build what's called motor memory. The second is the cerebellum, a fist-sized structure at the back of your skull that governs coordination, smoothness, and accuracy of movement. A well-trained cerebellum moves fluidly. An undertrained one, which describes most sedentary adults, moves stiffly, loses balance, and misjudges steps. But here's what separates dancing from every other form of exercise. While those 2 structures work, 4 more regions fire at the same time. The part of your brain that tracks where your body is in space. The part processing rhythm and tempo. The emotional center, lighting up with the pleasure of movement and music. And the prefrontal cortex, making real-time decisions about what comes next. 6 brain regions, working in parallel. Nothing else does this. Not chess, not demanding office work, not even yoga. Dancing may be the single most cognitively demanding physical activity a human being can do, and the research backing that claim is solid. Here's a detail most people miss entirely. The smoother you try to make a movement, the harder your cerebellum works. Not faster, not more complex, smoother. Chasing that fluid, controlled quality of motion is a direct training stimulus for the cerebellum. And current research shows the cerebellum isn't just about motor control. It's tied to how fast you process information, how well you shift attention, and how you regulate emotion. Every slow, deliberate movement in a dance class is quietly investing in the sharpness of your mind. Now let's drop below the neck, because the same principle, movement equals nourishment, applies to your spine. Most patients who come to me with back pain or stiffness have already spent money on chiropractic visits, massage, or injections that offer temporary relief without touching the actual cause. That cause, more often than not, is simple. The spine stopped moving. The discs between your vertebrae have no blood supply of their own. They get nutrients entirely through diffusion. Compression pushes fluid out, release draws fresh fluid back in like a sponge. Move your spine regularly, and your discs stay hydrated and resilient. Sit motionless for hours, which most adults do, and those discs slowly dehydrate and degrade. That's how herniations begin. That's how chronic back pain starts. Not from too much movement, but from far too little. Picture a full body wave, rolling from the base of your neck down through your lower back, each segment flexing in sequence, the kind of movement you see in West African dance or hip hop. That single motion mobilizes your neck, mid-back, and lower back simultaneously. No physical therapy exercise touches all three regions at once. Dancing does it naturally, and running alongside your spine are the sympathetic nerve trunks, part of the autonomic system quietly controlling your heart, lungs, and digestion. When the spine stays locked up for years, signal transmission through these chains slows down. That's part of why I see so many patients with chronic back pain who also struggle with digestive issues or irregular heart rhythms. The spine isn't just structural, it's a conductive highway, and movement keeps that highway open. Let's clear up a myth I hear at least 3 times a week. Movement does not wear your joints out. Incorrect movement wears joints out. So does no movement at all. Cartilage is nourished by synovial fluid, a lubricant your joints produce in response to being loaded. No movement, no fluid. No fluid, dry cartilage. Dry cartilage, early arthritis. That's the real mechanism behind most osteoarthritis in sedentary people. It isn't age doing the damage, it's disuse. Watch almost any dance style rooted in Latin America, the Caribbean, or West Africa, and you'll notice something. The knees are never locked straight. There's a soft, continuous bounce, absorbing each step. That's close to ideal for long-term knee health. Lock your knees while walking, and every footfall sends impact straight into the cartilage, thousands of times a day. Let the knee bend slightly, and that force transfers into the muscles of the thigh and calf instead, sparing the joint. That's the actual difference between a knee that lasts 90 years and one that's replaced at 65. The shoulder deserves its own mention, because shoulder problems are everywhere in American adults. It's the most mobile joint in the body, capable of rotating across multiple planes. And that mobility is also its weakness. Sit at a desk with your shoulders hunched for 8 to 10 hours a day, and the joint capsule starts to contract and thicken. The end stage of that process is adhesive capsulitis, frozen shoulder. People genuinely can't lift their arm above chest height, and recovery takes months. The prevention is simple. Move the shoulder through its full range. The shoulder rolls and shimmies found in African and Caribbean dance are essentially preventive physical therapy set to music. Now the hips and pelvis. Hip rotation, the movement that looks purely expressive in salsa or reggaeton, is, clinically, a genuine intervention for some of the most common complaints in my office. The iliopsoas muscle runs from your lower spine through the pelvis to the femur, and in almost every adult who sits for a living, it's chronically shortened and tense. When it stays that way, it pulls the lower spine forward, creating constant low-grade compression on your back. I had a patient, James, 57, an accountant, 6 years of lower back pain, 2 rounds of physical therapy, a year of chiropractic care. I asked him one question: when did you last rotate your hips freely? He had no answer. That tension doesn't stop at the back. The pelvic floor is closely connected to the hip rotators, and when the whole area stays locked up, the downstream effects show up everywhere. Bladder issues, digestive trouble, painful cycles in women and in men, chronic pelvic pain that often gets misdiagnosed as an infection when it's actually muscular tension. Hip rotation gently mobilizes all of it, no prescription required. One more thing worth knowing. When you first try hip rotation, one side will feel noticeably tighter. That's not random. It reflects years of imbalance, whether from posture, an old injury, or favoring one leg. The tight side is the one that matters. Work into it, gently but consistently. And that's real rehabilitation happening. Let's talk about your heart. Researchers at Northeastern University published findings showing that free-form dance, unchoreographed, just moving expressively to music. Satisfies the American Heart Association's full cardiovascular guidelines. 150 minutes of moderate activity a week or 75 minutes of vigorous activity. That's a complete cardio workout without the joint pounding of running and without the mind-numbing repetition of a treadmill. Your heart doesn't care where you are. It responds to demand, and dancing produces that demand in a way people actually want to keep doing, which, for long-term health, matters more than almost anything else. Bone density is another piece that gets overlooked. The rhythmic, weight-bearing loading involved in dancing, your body shifting direction and tempo constantly, stimulates the cells responsible for building new bone tissue. It's the same principle behind weight-bearing prescriptions for osteoporosis. Research shows regular dancing can slow bone density loss by 20 to 30%. For women near or past menopause, and men over 60, that's not a minor statistic. It's the difference between a fall you shake off and a fall that puts you in the hospital. Then there's the back extension movement common to tango and African dance. That arched, open-chested motion. It strengthens the deep muscles running alongside your spine, the ones that form its internal brace. Weak, and the spine collapses under load, discs get compressed unevenly, and herniation becomes far more likely. In a gym, this kind of work is tedious, and most people skip it. In a dance form, it happens naturally, and people do it for 45 minutes without even noticing. The slow, wide stance weight shifts you see across nearly every dance tradition load the thighs and hips isometrically, under sustained tension, without fast, jarring movement. That's ideal for anyone who's been sedentary for years, because it builds strength while minimizing injury risk. And your thigh muscles matter for more than walking upstairs. They act as the primary pump, pushing blood out of your legs and back toward your heart. Weak thighs mean poor circulation, swelling, and fatigue by evening. Strong thighs mean better circulation and lower clotting risk. Now let's get into brain chemistry. Not the structure this time, the biochemistry of mood. Dancing to rhythmic music triggers a simultaneous release of dopamine, serotonin, and endorphins. Dopamine drives motivation and reward. It's what makes you want to get up and do it again. Serotonin stabilizes mood. Low levels are tied to depression and anxiety. Endorphins are your body's natural pain relievers, responsible for that post-activity euphoria. That's essentially the same chemical combination antidepressants are engineered to approximate, except dancing produces it through a pathway your brain already recognizes as natural, with no side effects and no withdrawal. There's more. A single dance session can lower circulating cortisol, your primary stress hormone, by 25 to 40%. That matters because chronically high cortisol damages the hippocampus, the brain region responsible for memory, and suppresses immune function. Dropping cortisol by that much in 45 minutes isn't a wellness talking point. It's direct neuroprotection. Researchers in Australia found that dancing restores psychological health and cognitive function more effectively than any other physical activity tested, across both younger and older adults. And a study out of York University looked at patients with Parkinson's disease, a condition where the brain's dopamine-producing motor neurons progressively die off, and found that those who danced regularly showed measurable improvements in concentration, memory, and daily function, even as the underlying disease continued to progress. That points to something bigger. Dance builds what neurologists call neural reserve, extra capacity, a buffer, so the brain can keep functioning even after sustaining damage, because it simply has more built up to lose. Dance movement therapy is now formally recognized as a clinical treatment across the US and Europe, used in protocols for depression, anxiety, PTSD, and neurodegenerative disease. This isn't alternative medicine. It's evidence-based practice. Here's something worth sitting with. After age 45, your brain's capacity for neuroplasticity, its ability to build new connections, starts declining faster. After 60, that decline steepens further. But this isn't a fixed sentence. It's a trajectory you can alter, and it's exactly at this stage of life that learning new, coordinately complex movement becomes most valuable. New motor patterns at 50 aren't just exercise. They're a direct countermeasure against cognitive aging. So tell me, how old are you? I'm asking seriously. Drop it in the comments, because the guidance that fits a 38-year-old and the guidance that fits a 68-year-old are genuinely different, and age shapes nearly everything I recommend in my own office. Here's what I want you to actually do, starting today. First, dance for 10 to 15 minutes a day. No studio, no partner required. Your living room, music you enjoy. 10 minutes is enough to trigger every mechanism we've covered. Zero equipment, Zero membership fee, zero excuse. Second, try at least one movement you've never done before, every session. The neurological payoff comes almost entirely from novelty. Once a movement becomes automatic, its brain-building effect drops off fast. Keep pushing into unfamiliar territory. Third, aim for smoothness over speed. Slow, controlled, fluid movement is harder than it looks. It demands more from your cerebellum and engages deeper stabilizer muscles than fast, sloppy movement ever will. Fourth, find your restricted side and work it. If one hip won't rotate as freely as the other, that's a real clinical finding, not a coincidence. Work into that stiffness consistently, not aggressively. Fifth, let go of rigid control. When you allow your body to move freely instead of micromanaging every muscle, the deep stabilizers of your spine and pelvis switch on automatically. They need unpredictability to activate. That's their training stimulus. The most effective medicine is often the kind that doesn't need a prescription. 5 minutes of dancing can do more for your spine than a bottle of anti-inflammatories. 20 minutes can do more for your mood than what gets prescribed for mild anxiety. 30 minutes, 3 times a week, can outperform most supplements on the market for long-term cognitive health. I've spent 15 years watching patients pay, financially and physically, for outcomes that could have been prevented. That's not a knock on patients. It's a knock on a system built to profit from treating illness, not from building health. They make money when you fill a prescription, not when you learn to move. If this helped you see your body differently, share it with someone who needs to hear it. Hit subscribe, and let's keep building toward 200,000 people who want real answers from a practicing physician. I'll keep making these as long as you keep watching.